What is occupational asthma?
Occupational asthma is a form of asthma triggered by inhaling substances in the workplace, leading to airway inflammation, reversible obstruction, and bronchospasm. Symptoms include a cough, shortness of breath, chest tightness, and noisy breathing. Some individuals may also experience upper airway symptoms such as itchy eyes, tearing, sneezing, nasal congestion, and rhinorrhea.
What are important clues in diagnosis?
Symptoms have developed recently, or within the first few years of joining a job, improvement in symptoms during periods away from work. Then, do think of occupational asthma.
What are common occupations associated with occupational asthma?
Manufacturing and industrial workers, due to isocyanate exposure. Healthcare professionals, due to latex and chemicals. Bakers and food processors, due to flour dust. Woodworkers and carpenters, due to wood dust. Animal handlers and veterinarians, due to animal proteins. Textile workers due to dyes and fibers. Agricultural workers due to grain dust and molds. Hairdressers due to chemical agents.
Well then, how do you investigate?
One, skin testing or measurement of specific IgE to the agent in question. 2, pulmonary function test, peak expiratory flow rate. PEFR monitoring is a valuable tool in diagnosing occupational asthma. Significant variations in PEFR readings between work and non-work periods support the diagnosis of occupational asthma.
Now let's go to management.
Remove the worker from the implicated agent. Personal protective equipment and workplace hygiene. Consult your family doctor for further details on management.
Implementing these measures can improve symptoms and lung function, though considerations regarding employment and income may arise when eliminating exposure. All right, folks, that's all for today.